All right, everyone, good morning. It is 8:04 a.m., Friday, August 15th, 2025. I'm going to go ahead and call the full board to order. And if we could have roll call.
Yes, Dr. Zaffron.
Present.
Dr. Farmer.
Present.
Mr. Kokonos. Mrs. Barnes.
Present.
Dr. Bhatia.
Present.
Mr. Crane. Dr. Deloche. Mrs. Del Rosal.
Here.
Dr. DeStefano.
Present.
Dr. Green.
Present.
Mrs. Harrod.
I'm here.
Dr. Jones.
Here.
Dr. Martinez.
Here.
Mrs. Morgan.
Here.
Dr. Naidu.
Yeah.
Dr. Quinones.
Present.
Dr. Tibbles.
Here.
Mrs. Troncoso.
Present.
Dr. Vanderwide.
Present.
All right. We got 16 there, so we have a quorum and may proceed.
Great, thank you. We always start our board meetings with reading our mission statement. Our mission is to protect and enhance the public's health, safety, and welfare by establishing and maintaining standards of excellence used in regulating the practice of medicine and ensuring quality healthcare for the citizens of Texas through licensure, discipline, and education. I'm going to start off the board member report, or with the board member report. We have a couple of things. Of course, we are actually at the last day of the special session. I believe it's Sunday today.
Of this special session.
Of this special session, the first special session. We had mentioned in the last meeting what had gone on through the regular legislative session. There have not really been any items in the special session that have impacted us directly. The other things that are of note is a couple of the rules or laws that have been passed. We are going to be looking at rulemaking around those. Some of these are fairly large and impactful laws that will take a little bit of making sure that we've got enough stakeholders having their input as we are looking at writing rules around this for the next October meeting, with an anticipation, hopefully, of having public input and in December looking at possibly passing this. So right now we are targeting September 11th for a stakeholder meeting. Now these stakeholders are by invitation only, so we are going to be looking at a wide variety of stakeholders, from official entities like the ABMS, the FSMB, obviously the Texas Medical Association, as it's going to be impacting physicians here, and other interested entities. So we will be having more on that. There's obviously some private entities out there that may be interested, and we will be reaching out to them and looking at having that stakeholder meeting on September 11th. We are also additionally going to be looking at having a stakeholder meeting around ketamine rule adoption. This is another important aspect of a new business model that is out there in the public domain, and it is important that we put out rules and regulations that ensures public protection with something that is very strong, a medication that is very strong, and potentially, if not used in the correct environment, can have a detrimental impact. But it does have positive effects on patients who have chronic depression, potentially who have chronic pain. So there is a use for it. We just want to make sure that it is used in the appropriate setting with the appropriate rules and regulations around it.
Sharif, can I ask a question?
Sure.
Is September 11th only for HB 2038, or are you going to do others that day too?
Those are going to be the two items that we're going to be doing, both the HB 2038 and the ketamine rules.
Okay.
That's primarily what we're going to be focusing on. And again, I would just emphasize that these are going to be invited entities. If you guys have stakeholders who would like to be involved, or potential stakeholders like to be involved, please let Brent know. And we want to make sure that we have the right balance and not be overwhelmed by it. But of course, we want to make sure that that people can appropriately have their input. And I would remind everybody that as the rules are going to be proposed in October, there will be quite an opportunity, at least 30 days, if not more, it'll be more, but at least 30 days for the public to have input. So even if those are not, if there are some folks who are not able to be part of the stakeholder meeting, they will certainly be able to provide input with the public comment period after the October board meeting. The other item that I would just mention, we have had a new process in our DPRC. We actually started implementing this yesterday. One of the things that we were mindful of is that there's a large number of appearing appellants, whether it's physically appearing or virtually appearing, and seeing how we want to make sure that all appellants who are virtually or physically appearing have a chance to have time with the board, with at least the DPRC, and able to provide testimony or comments around their appeal. That we have divided the DPRC, at least for that portion, into two subcommittees, and essentially just splitting the DPRC in half, just for listening to the testimony from the appellants. The full DPRC still gets together and debates and looks at all the information that was presented by all the physically and virtually appearing appellants and makes recommendations based on that. Two more in person. So, and I think we highlighted yesterday, and Brent, when he gives his report later on, we'll talk about what the following board meetings in person will be. We try to make at least 2 board meetings a year in person, so that we can all, of course, meet each other, see each other in person, and have that perspective. So the October board meeting will be one of those. And I'm sure you'll get all the information as to lodging, logistics, all that kind of stuff. And finally, we have a new medical director. Brent will be speaking a little bit more about that in his report. But you know, it's an important role that the medical board needed to fill, and we're lucky and privileged to have somebody who's going to be in that role starting very soon. All right, any questions by the board members? Great. Okay, agenda item number 3, going into business. Consideration and possible action regarding dispositions below minimum guidelines. There's one item in that agenda. Is there any extractions, recusals on that agenda item? Is there a motion on agenda item number 3?
Motion to Stefano.
I think I need to recuse myself. Right.
Who's recusing?
Del Rosal.
Okay.
But I don't
So
know.
Mr.
I'm
Rosal.
new, so I don't know if I need to.
It's, you know, just if in doubt, just go ahead and do it. We can always go
I'm
into
just gonna
that. or
recuse
Scott-
myself. Yes.
Okay, well, actually, let's just take a pause and moment. And Scott, why? Just since we just, you know, we're in public, and it's
Just
always a
because
good
you
thing to remind
served on
ourselves
it,
of.
yeah. Just
Yeah,
because
why
you
don't we
served
go
on
ahead
the
and-
ISC panel doesn't mean you have to.
Thank you, Wendy. That was a question.
Okay.
Thank you.
It's okay. Just in general, let's go ahead and just give a broad overview of the recusal process.
Right. The recusal process is the right or a motion you can make yourself, but it's not just simply because you participated in the ISC or something like that. It is more for like the physicians and others. You know, if you have a professional association, or if you know somebody, you know, a lot of our physicians run into, oh my goodness, I refer to this physician a lot, or she's, you know, works with one of my partners years ago, or I went to school with him, or for you that maybe are not the physicians, but your business associates, your professional associates. And it is even, and it is, if unless you don't think you can make a fair and unbiased decision, you can still do it. But again, if you have any doubt, it's always better to recuse, so there's not the perception of, you know, somehow you favored this physician, or you had it out for this physician, or something like that. But in and of itself, doing a temporary suspension, doing an ISC, perhaps even in the case of like our DPRC committee, as Dr. Zafran was mentioning, if you kick a case back and say, I think it should be further investigated or something of that nature, you can still vote on it as long as you, don't come with any, bias or predetermination. But it's a very kind of broad concept, and it's more, even if you're like, I really don't know this person, but I went to school with them 20 years ago, I'd feel better and not voting. That's perfectly acceptable.
And in most instances, it's a personal judgment call.
Yes.
There are instances where recusal is appropriate, and sometimes that may be something that would be recommended on us. But in many instances, even if you have a vague knowledge of somebody, that doesn't necessarily mean that you have to recuse yourself. So it is a judgment call as to whether you feel like you could be unbiased or not. But as Scott said, if in doubt, it's always safer to recuse, and that way just eliminate any instant of doubt. I don't think we've had very many, almost 50-50 votes, but again, that's the process around that. So with that, going back to agenda item number 3, are there any extractions or recusals on agenda item number 3? All right, seeing none, is there a motion on agenda item number 3?
Motion DeStefano to approve the item.
Second, Morgan.
Okay, DeStefano, James, could you please just specifically say what the motion is?
Motion to accept the consideration of possible action regarding disposition below minimum guidelines.
Great, thank you. And it's been seconded. Is there any further discussion on agenda item number 3? All right, all those in favor, please say aye.
Aye.
All those opposed? All right, motion, agenda item number 3 passes. Agenda item number 4, consideration and approval of mediated settlement agreed orders. Is there any extractions or recusals on agenda item number 4?
Let's come to you. I'll provide the guidance. You and me. And the narration plan.
I think if any of you guys could mute your mics while you're not speaking, that'd be great. So with agenda item number 4, any extractions or recusals? Seeing none, is there a motion on agenda item number 4?
Motion
I
to
move
approve.
that we accept the consideration and approval of mediated settlement agreed orders, Herod.
Okay, we have a motion on 4. Is there a second?
Second, Vanderwide.
Seconded by Dr. Vanderwide. Is there any further debate or discussion? All right, seeing none, all those in favor, please say aye.
Aye.
All those opposed? All right, motion passes. Agenda item number 5, consideration and possible action for remedial plans. You have administrative rules, crime laws, which there is none, impairments, which there is none, peer review, state action, standard of care, unprofessional conduct, and late orders. Are there any recusals or extractions on agenda item number 5? And I will go ahead and extract number 28 in agenda item number 5.
I have number 23 and number 18.
Those are to recuse or extract.
Recuse.
Okay, so we have a recusal by Dr. Bhatia on number 18 and number 23, and I'm extracting number 28. What I'm going to go ahead and do is I'm going to vote on everything else, or I'm going to ask for a vote on everything else, and then we'll go back to number 28. So in agenda item number 5, with is there any further debate with just understanding the recusal in 18 and 23 by Dr. Bhatia? Seeing none, is there a motion on agenda item number 5?
Quinones, motion to accept consideration and possible actions for remedial.
Okay, with the recusal in place and with the exception of 28, all those in favor, please say aye.
Need a second.
Second,
Aye.
Vanderwide.
Aye.
All those opposed? Okay, so item number 5, except for 28, passes.
We
So,
did not have a second on that
Second,
motion.
Vanderwide.
No, Dr.
Okay.
Vanderwide had seconded. So on number 28, this was a late order. This was a case that involved a patient that went into the emergency room and had an infection. I believe it was a urinary tract infection. She was 24 weeks pregnant and was given oral antibiotics instead of IV antibiotics, and was also did not have fetal heart tones monitored or actually even checked. I believe the patient was discharged on the PO antibiotics. She appeared at another emergency room later on, and again there were some failures there. The third time that she went, they finally treated her properly, but unfortunately it was late in the process, and the patient expired. My understanding is that this has nothing to do with anything or concerns around the fetus itself, or around, when she came the first time around, she had by all indications, we think she had a viable fetus, although the fetal heart tones were not checked. But the indication by the expert panelists was that there was a violation of the standard of care. With urinary tract infections during pregnancy, you have more resistant organisms. At a minimum, there's a recommendation for IV antibiotics, and potentially to be admitted. But also, at a minimum, there should be a check of fetal heart tones to assure that there's a viable fetus in a potentially viable fetus, because if there were any concerns or problems at 24 weeks, the baby could have survived. The action taken on the subsequent visit involved an agreed order, and so there was something that was rendered based on the ISC panel having looked at that specific case. In this instance, it was a remedial plan that was offered, which is below standards, and it's inconsistent with the offer that was given in the subsequent ISC that involved the second ER visit. So with that, and again, considering that, and I did look at the mitigating factors. I know that this person didn't have a previous board order, and I know that they were very remorseful, and I know there were concerns whether the action of not giving an IV antibiotic, whether it directly resulted in a death or not, but there was, at least in the subsequent visits, very clear indication that the UTI did eventually lead to sepsis, which led to the patient's demise along with the fetus. So my recommendation on this specific item is that it would not be a remedial plan, but it would be an agreed order, also similar that with the subsequent one. Is there any comments by staff that you'd like to provide?
Yes, if you are making a motion, just some clarification on what the ordering terms that you would like. If you'd like those to say the same, which is currently 8 hours of CME, or if you want to recommend something different in your motion, that would be helpful for staff.
What were the provisions of the agreed order on the subsequent one?
I can get you that information, but I believe it was something very similar.
Okay. I mean, from my standpoint, if it was very similar, I just think it just needs to somewhat mirror that. But I think it should be an agreed order since there was a death involved. And I'm not sure that there's really any kind of clear indication that this specifically did not involve or lead to the death. I think it probably did. And I would make a motion that we make this an agreed order with the similar provisions that are there.
So the motion would be to convert the remedial plan to an agreed order and make, just the formatting revisions. Is that correct, Dr. Zafran?
That is correct.
All right.
Dr. Zafran, Dave Vanderwide. Just some additional questions. Am I to understand both the patient and the fetus expired as a result of this?
Yes.
Thank you.
I'll second your motion if you made one there, Dr. Zafford.
Thank you. There's a second by Dr. Bhatia. Is there any further discussion? All right. All those in favor, please say aye.
Aye.
All those opposed? All right, item passes. Going to agenda item number 6, consideration and possible action for agreed orders. Under there is administrative rules that are none, crime laws that are none, impairments, peer review state action, standard of care, unprofessional conduct, there are none, and late orders. So for agenda item number 6, are there any extractions or recusals? All right, with that, is there a motion on agenda item number 6?
Motion, Quinones, for accept consideration and possible actions for agreed orders, item number 6.
Is there a second?
Martinez. Second, Martinez.
Seconded by Dr. Martinez. Is there any further discussion? All right, all those in favor, please say aye.
Aye.
All those opposed? All right, agenda item number 6 passes. Number 7, consideration and approval of modification request, termination request orders. Is there any recusals or extractions on agenda item number 7? With that, is there a motion on agenda item number 7?
Vanderwide, move to approve consideration and approval, modification request, termination request orders.
Second, Bhatia.
Motion by Dr. Vanderwide, seconded by Dr. Bhatia. Is there any further discussion on agenda item number 7? All those in favor, please say aye.
Aye.
All those opposed? Item number 7 passes. Number 8 and 9 and 10 and 11 and 12 and 13, there are no items there. Agenda item number 14, which is a proposal for decision. There are no items today. And with that, we will move to the executive director report.
You. Good morning, everyone. Moving quickly through the agenda today. As Dr. Zafford mentioned, we are going to have a new medical director joining us. So we are very happy about that. It's going to be Dr. Rajesh Shinava. He was one of our DRC members. So some of you may have had some interactions with him in ISCs. But it's great that he has some experience with the board. He understands kind of what we do and how we do it and why we do it. He's out of Houston, practices nephrology. He'll be joining us on October 1st. So we'll be looking forward to having him for the October board meeting with us. As Dr. Zaffron already said, we're going to have a stakeholder meeting September 11th to cover IMGs, physician graduates, ketamine. We'll see if there's anything else we want to squeeze in there. It'll be a long day, but we'll get a lot of good input from our stakeholders. We do kind of have a standard stakeholder group that we do notify when we are going to do these things. We've had some others that may be outside of that group that have reached out, and so they'll be notified for this meeting as well. And we've had a few legislators also ask us about when these new rules will be implemented, and so they'll be notified. As Dr. Zaffron said, the notifications will go out about this. We'll ask them to RSVP back to them just so we have a good count of how many people are going to be participating, to also try to gauge the limitation on comments, on how much time each person will be allocated. Any written comments they have, obviously we'd like them to send them to us in advance. It won't necessarily be a closed meeting because it is a stakeholder meeting. So you guys are welcome to observe and see that as well. Overall, the plan for the rules is to have the stakeholder meeting in September, have something available for you guys in October to hopefully approve and publish into the Texas Register. That'll start the clock, at least the 30 days Dr. Zaffron referenced for public comment on the rules. And hopefully we get some good comments. We can make whatever revisions we get based on those comments in December. Hopefully you will be able to vote on a final rule to adopt, and that rule would be then go into effect for January. And we'll be able to start accepting applicants at that time for these new licensure pathways. One other thing, he talked about the board meeting. So again, just the dates. I mentioned them yesterday, but once again, for anyone that's with us today that wasn't with us yesterday, The next board meeting will be October 16th and 17th. That will be in person here in Austin. December 11th and 12th, March 26th and 27th, June 11th and 12th. That'll be the second in-person meeting for this fiscal year. And the last one for the fiscal year will be August 13th and 14th. One other comment is about the subcommittee. As Dr. Zafran said, it did work pretty well yesterday. There were a few bumps as we were figuring this out and making some adjustments, but we figure we saved at least a couple hours of time by splitting up the committees that way. And I think it'll get even faster as we continue to get better at this and do it. So we'll have some logistics to figure out in October board meeting, because normally we only use 2 rooms. So now we'll need 3 for licensure and 2 subcommittees, but already talking with staff on how to make that work. I'll turn it over to Joey for the finance update.
Thank you, Brent. Good morning, board members. So we're wrapping up fiscal year end here at the end of August. Revenue collections through the end of July are currently over $39 million. This is in line with our projections for the fiscal year. We should have about a 3% increase from the prior year. I did run numbers for collections through Wednesday of this week, and we have collected just over 1.6 million for August. So that's still in line with what we're projecting. So everything's working out great there. Expenditures, as always, we'll spend every penny appropriated to us, so no concerns with that. We are planning to wrap up paying all our expenditures through the end of next week to meet comptroller our deadlines, and then working with our fiscal year 2026-2027 budget and setting that up. Just for visibility and reference on y'all's part, based on what the legislators appropriated to us for the next biennium, we have just over $5 million more from this last biennium. And I wanted to highlight that this is forever money. There's no one-time money in this funding that was awarded to us. So hopefully the agency will be able to retain those funds forever moving forward. And we also received enough funding to fully fund and support our 270 FTEs that we've been authorized. So very excited about that. We've also set our fees for PHP, NPDB, and PNP going into 26 and 27. As y'all recall, the legislators passed our authority to collect fees for PHP and NPDB across our other license types outside of physicians. That'll take effect December 1. And then we are also looking to bring the jurisprudence exam in-house. That'll take effect September 1. The reasoning behind that is we are not collecting as much as we'd like to with appropriated receipts because of other external factors. So bringing that in-house will actually allow us to bring that cost down to our licensees. They currently pay about $140. We're going to charge them $50, so that's 65% savings for them. And that should help us with our appropriated receipts collections. I've also provided everyone with supplemental data that I typically provide. And we did some revamps with the licensee map. So those have additional information on them. And as always, we're looking to get those cleaned up for y'all and have more information just for visibility. So if you have any additional information you'd like, please let us know. We'll incorporate that. And then finally, I did prepare a draft fee report. There has been a lot of conversations with the legislators and some of our oversight agencies regarding our fee collections and how that impacts our budget. So we've started collecting information from all the other states, and it's still a work in progress. We have a lot of data that we need to mine through and prepare for additional charts and graphs and whatnot, but that's coming along great. I'm really excited about what that final product will look like. So again, if there's information that you think might be helpful, let us know and we'll incorporate that. And I just want to point out a couple things based on what we've seen so far. Texas is not the highest state in regards to our license, what we charge for a license and renewal. We are in the top 10, but we're not in the top 5. And then over the stretch of 30 years of practicing physician in Texas, what they pay to stay renewed here in Texas, that puts us about ranked at number 15 compared to the other states and what they expect their physicians to pay for them. So overall, Texas, I think, is doing a great job of where our fee is at and how we're administering that. And then just for fun historical information, back in 1837, when Texas started collecting a license fee from physicians, it was $20. And inflating that to this year's date money, that would put us at $673. So our fee collection is not too far off from that. And depending on how things shake out, maybe we can try to target in the future having our fee set to kind of be in line with that, just to be fun. So pending any questions, I'll hand it back to you, Brent.
Pretty neat fact. Well, I was going to say, again, a great job for you and your staff and all the staff. I think our current fees, our baseline fees, right, they haven't gone up since 2013, 15.
That is correct.
Something like that.
Yes.
So our fees that we charge have stayed flat. Of course, the legislature has had other things that have come up since then, like the PMP fee and the Texas PHP and NPDB. The licensees do pay that additional that they didn't have in years past, but the fee that the medical board is actually charging has remained the same now for 10 years or longer.
Mm-hmm.
So great job to the staff, and they will be able to continue to work throughout all this time despite the increases in inflation and everything. And the last thing I'll say about Joey and his team on what they were able to work out is they were able to, starting July 1, we were able to work our books, and going forward into the next biennium, we were able to give raises to the staff as well. So great job. Thank you for that. And great job to everybody. And I'm happy to take any questions.
I have a comment.
Yes.
So based on that historical tidbit, the last president of Texas when we were a country was a Texas physician. And look at what's on my desk. So Anson Jones is his name. And he was
Any
our
relation?
president. No, not that I'm aware of. But I really like that historical tie-in.
Yeah, that'd be pretty neat, I guess, if we could say that our fee is the same as it was in 1837. Yeah, relatively. But
yeah.
Anyway,
At the same time, I think it was the physician who said, "Come and take it," when he was talking about his licensing fees. So I'm not sure if that's where that came from, but it could have.
I think
have a
that was
question.
yes. What is it?
I'm sorry, question for Joey. I assume we did market measurements. Was there a percentage kind of across the board for pay raises?
Yes, we gave a minimum 5%, and then we also targeted our employees that were not at the hourly rate that we wanted them to be at, and we increased that to meet it to where we expected that to be. So I can happily say, I think last time our target was $20. We've increased our minimum now to $22.50. So my end goal personally is to have everyone minimum $25, but we've got some work to get there with the legislators.
And I was going to say, let me just be specific with that, is that had to make strong advocacy efforts with the legislature in order to be able to get this with the constant budgetary requests or requirements that we have out there. So luckily we were able to get most, if not all, of our budgetary requests, especially around salary adjustments. I mean, we still have some that we need to be able to fix. I know that our executive leadership, I think, needs to be in line with other agencies in the state, especially those that have similar number of licensees. So that's something that we still need to continue working on.
Okay.
Yep.
Well, yeah. So they're not totally inflated, but no, the 5% is a good number. Thank you.
Yeah.
No, I think it's in line with what we were, because remember that during the 2020 to 2024 period, we were actually behind, and we had to kind of do a little bit of catching up.
Right.
So we're still in that catching up period. Remember, we had a lot of folks leave because we were way below the market. And I think as Joey and as Brent alluded to beforehand, the cost of hiring a new person is significantly higher. Actually, I think Sharon, you made that point.
Yeah, exactly.
Is significantly higher than retaining what we have. Right. So it is an important investment, especially with inflation and the cost of living in general. And of course, we do not encourage. We mandate to a certain extent that we have folks be in play and working at the agency and not remotely for the most part. So it is important to make sure that we have adjustments for cost of transportation, cost of living, and all that kind of stuff. So
okay,
all right.
Thank you.
Anything else? Yeah.
I have a question, Joey and Brent. This is a new girl question, I'm sure. Remind me, do we capture all of the fees, or do we have
100% of it, Kelly? Come on.
Well, we collect 100% of the fees. We do not get to spend 100% of the fees.
That was what I thought. What's the percent?
It is improved. So Joe can give us the latest, but when I started here, we were getting to keep around 40 cents on the dollar of what we collected. I think now we're getting high 60s ish.
Right now we're at 65, and going into next year we should be closer to 70, 75.
Okay.
So
Yeah.
it's a lot better.
Now the
And
PHP
does the
fee-
rest go into like the state general fund?
Yes.
Yes.
Now, the PHP fees and all that, 100% of that does stay with us because that is specifically allocated for that program. We can't spend it for other budgetary items. But I would remind everybody that that PHP fee allows physicians who need the help that they need to be able to, and may not be at a time in their life where they can afford it. It allows us all to put in a small amount of money in our biannual renewal to help fund that. And the change, just to remind everyone, that was made at the previous legislative session was that all licensees, including the non-physicians who are under the medical board, are now also contributing to that amount so that they can also receive, or they've always been receiving it, but that way they're all contributing to the fund that helps pay for that.
Yeah, that fee is going to be $7. So that's $7 for every 2 years, and it's not even per year. So it's a lot of great stuff we're able to do. But yeah, PMP, NPDB, and the Texas PHP fees, those are all 100%, and they go straight to the programs that they're allocated for. It's that other kind of baseline fee that we collect where the general fund does keep a portion of it.
Thank you.
Yep. All right. Any other questions?
Thank you.
All right, great. Number 16, medical director report. I'm anticipating that at the next meeting, we will have a report. Yep. Item 17, Tori.
Yeah.
Ms. Sloan.
Good morning, everyone. I only have one item to cover with you all today, but it is a big one. It's the launch of the new TMB public website. We've been talking about this for the better part of a year now, but the finish line is finally in sight. Assuming all goes as planned, the revamped website is scheduled to go live on September 2nd. Along with that will be a new web address. We'll be shifting from the tmb.state.tx.us to a little bit shorter, tmb.texas.gov, which means that our email addresses are also going to be changing as well. Don't worry though, folks trying to reach us via that tmb.state.tx.us will still be able to do that for several years, in fact. So we'll have plenty of runway to communicate that change to the public and update forms, documents, and other collateral. But those initial external communications are actually going to begin very soon. We've already started sending some out internally to staff to make them aware, but we're going to start pushing out external communications as well. So be on the lookout for those. As I've mentioned before, the new website will have a fresh new look that's with improved navigation. It'll be more modern, hopefully a lot more user-friendly and intuitive. It will feature an AI chatbot. This is going to allow folks to essentially get help 24/7. It will be able to answer questions and direct users to relevant pages. There's some other special features planned as well. Along with the AI chatbot, those items may not launch right away with the new website, but just know that there's some great things coming in addition to the new website itself. Finally, I do want to recognize a few key TMB team members who've been instrumental in getting us to this point. It's been a year in progress, and there's been some folks that have been really just chin deep in this effort. The first person I want to recognize is Mr. Salem Shua. He's been serving as our project manager and therefore chief cat herder and taskmaster. I'd also like to recognize Miss Karen Hardwick on my team. She's been lending her amazing graphic design skills to the effort. Miss Ray Hines, our registration director, and Miss Grace Unterborn, our licensure director, and of course, Leah Penellis, our business analyst extraordinaire. If you've looked at our website, you know that the bulk of the information on there is related to licensure renewal, so their input has been absolutely invaluable. And last but not least is our amazing CIO, Jeff Colassius, without whom nothing IT related at the TMB would be possible or even work. So I just wanted to give a special shout out to those folks. They were kind of part of the core team, and they spent a lot of hours in addition to their regular duties doing this special project. So thank you to all of them. I know there were a lot of other folks who participated in this effort, too many of them to name, but I want to extend our sincere thanks on behalf of the entire agency to all of them as well. Think that's all I have for today, but I'm happy to take any questions.
So if I could just add into that, back at the 2023 legislative session, Brent and myself and others made a strong effort to get the funding for the website and other important things like digitizing a lot of our paper records and so forth. And I can't begin to tell you how critically important that is. When we talk about the amount of time it takes to do an investigation and stuff like that, it really kind of hampers us when you don't have records easily and readily available through technology to access that information. We as board members, we look at hundreds and hundreds of different bits of information that we have to access. And if it's more difficult to access those, it makes it more difficult for us to render a good decision. The other thing that is critically important, and I hear this from a lot of our licensees, is the interface between our licensees and our agency has always been a struggle. Now, I'm proud of the fact that since in the last 7 years, I would say that it's improved significantly, but nowhere where we would like it to be. And a big part of that is really something that we have no control over, like, again, funding and so forth to kind of get us where we need to get to. Since we've gotten the funding in 2023, I know Tori and her team, and as she mentioned, everybody else in the team have done a magnificent job in taking input and having at least that interface between our licensees and between the agency become a lot more user friendly. I personally get a lot of questions from licensees. I try to help answer them or get them to the appropriate folks, but that I'm sure there's 10 times that, and I know each one of you have the same thing. There's 10 times that out there who may not have the ability to, communicate with somebody who can easily help them get that information. And I think the new website with its AI interface, with the ability to access information, a lot of times it's just easy questions. It's just sometimes hard to find the answers to. Will be able to significantly help our licensees get those answers and not feel a level of frustration and really, not being able to get answers to something that may be fairly simple. But for a licensee who's trying to get an answer to something that is meaningful to them, like getting a license application in time, getting information that we're asking for them in time, and all that kind of stuff, this will go a long way, I believe, to help improve customer service. But I think even more important than that is the public and their ability to access information from us. I think it's going to be critically important. Again, our mission is to serve the public and the citizens of Texas, and their ability to find out about their licensees, about our licensees or physicians that may be taking care of them, or other licensees, PAs, and others who are taking care of them, I think is going to be critically important. One of the questions that I get all the time, and I know Brent gets this all the time when we're sitting in front of the legislature, is about our customer service and our ability to answer and so forth. And just like any other state agency, it's limited again by funding. I don't like saying that we're a bureaucracy, but we are. There are certain rules and regulations that we have to follow before we can release information and so forth. But that does not mean that we cannot provide good customer service. And I think we've come a long way, thanks to the efforts of our IT guys and Tori and Brent and the team to kind of get us to that point. That does not also mean that it's going to be the end of the road when this goes out. I think we as board members, it's going to be critically important for us to test this out and give feedback as to where there could be improvements. And I know that the team is going to be fairly responsive. I think part of the advantage, Jeff, with the new interface is that it is easier to make changes if need be. Sometimes I feel like we're working with DOS 1.0, and those are very, very hard to make changes on. But with the new kind of interface, it'll be a lot easier to have responsive changes. So again, thank you. And I think, like I said, I'm spending a little bit of time on that because that public interface between us and the public, between us and our licensees, is always a friction point. And I'm hoping that this will go significantly far in helping provide the information, access to information that will help our licensees and help the public.
Thank you for that, Dr. Zafran. And I will say that you're right. If you guys, as you're using the website, please provide us with that feedback. We are kind of thinking about the website in terms of like 2 phases. We feel like this is the end of phase 1. And then once it launches, we'll go into phase 2, because now that we'll have this nice, shiny new product that actually works really well for us, we can see, you know, what we can really do with it. So we definitely have things planned for this phase 2 to make it bigger and better. So yes, as you're all using it, please provide that feedback to Dr. Zafran or Brent or myself, and we'll look at that and see how we can incorporate it and make it better.
Great. Thank you. Thanks, Tori, for great work. All right. Agenda item number 18, a report from our physician assistant liaison. Ms. Corbett, are you on?
I don't believe Ms. Corp is going to be in attendance this morning.
Okay. All right. 19, consideration and possible action regarding pending litigation. Mr. Freshour.
Yes, good morning, everyone. As usual, I'm going to, it's kind of the standard report. We have quite a few reviews going through on agreed orders that have been to SOA, where the physician is appealing, saying, you know, this was, you know, not justified, et cetera. We win those cases very, very routinely because, again, as long as there is some basis within the judge's decision, you can make a finding against the physician. And then the only thing that the court sometimes look at is the proportionality of a penalty, if any, assessed. And of course, y'all are very good about doing that. And again, that's what my team does when there is a proposal for a decision. We give you advice on what a standard sanction is and et cetera. So those all are going through fine. We did have 2 cases that I want to touch on rather quickly. They were both cease and desist cases. Both of them went up actually past district court and went on to the Court of Appeals. And in one case, the individual was licensed in the Philippines, but was never licensed in Texas. This individual was advertising all kinds of, you know, take this supplement, take that, it can cure this. She was a female, held herself out as a physician without the disclaimer that she wasn't licensed. So we took a cease and desist against her. She appealed, said we couldn't do it. Plus, she tried to assert the company that she was using was not hers, even though it was owned wholly by her and her husband, and that it was based in Oklahoma. Therefore, we didn't have jurisdiction. And the court said, no, you're advertising in Texas to Texans. You didn't have a license. Cease and desist is appropriate. The other one we had was a individual didn't feel well at a restaurant. EMS was called. They show up. The individual's, I think it was a sister or a relationship, said, don't do anything to her. I'm her doctor. She doesn't need anything. Leave. And of course, EMS is like, well, are you her doctor? And she's like, yes, I'm her doctor. And of course, it turns out she wasn't a doctor at all. And so again, it was a holding out. The individual tried to claim, I wasn't, you know, trying to treat her or cure any disease, and I can treat her because it was a family member and that's what she wanted. And the answer was, well, you could have just said no to EMS, but you didn't have to say you were a doctor. And the moment you said you're a doctor, obviously that's improper holding out. And theoretically, when you refuse treatment now, you are practicing medicine. And the court upheld both of those. So not surprising, but it's good to know that the courts recognized the importance of, you know, who is a doctor and who's not a doctor and how you can present it. So I think that's the key on those. With that,
thank you, Scott. And
I'm sorry, go ahead, Dr. I was just going to say, and unless anyone has any other questions, that's my report for today.
I was going to just highlight, you know, the cease and desist process is a critically important tool that we have that we use sparingly, but it's a very important tool that we use when somebody's holding themselves out to be a physician who's licensed in the state of Texas. And as Scott highlighted, you know, the 2 that he's describing, I'm presuming don't hold any other licenses in Texas, but when we see somebody who's practicing medicine without a license, we're kind of agnostic as to whether they hold a license or not hold a license in the state of Texas with anyone else. I know this was an item of contention, but from our standpoint, our critical and first important and foremost duty is to protect the public. And it is important for those who may be holding out to be practicing medicine without a license for that to stop immediately. And then it can be referred to another licensing agency for proper discipline or additional discipline if they are. And if not, then at least, as the courts have reaffirmed, that we can ask them to stop making that claim and potentially harming the public by deceiving them in what their role may or may not be. So I really always appreciate our counsel who makes sure that not only do we properly enforce and uphold those laws, but make sure that even when they are tested in the courts and that they are upheld and that we're allowed to use those tools, even though we use them sparingly and appropriately. Any questions? All right. With that, reports and automatic orders, you have them there if you have any questions. Consideration approval of orders to show cause. I believe there are none there. Consideration approval of revised, vacated, and amended orders. There is none there. 23 through 29. This time, of course, there are no rules for us to discuss. I anticipate at the next board meeting, it'll be a little bit more of a discussion than what we have today. And that brings us to agenda item number 30, which is our open forum for public comment.
Thank you, Dr. Zafran. Most people are familiar with this process by now, but I'll just quickly highlight it. This is the opportunity for anyone that wants to make a comment to the board to do so. If you'd like to make a comment, your comments will be limited to 3 minutes. We do not have anybody here in the room with us that's observing or participating. Is there anybody online that would like to make a comment to the board? If so, you can raise your hand on Teams or just go ahead and state your name if you've joined us by phone. Not hearing or seeing any. Sometimes if you're on mute, I'll give you a few more seconds to unmute yourself and say something. And if not, then we'll continue moving on. All right, not hearing or seeing any. So that completes agenda item number 30.
All right. Number 31, discussion, recommendation, and possible action relating to personnel matters. There are none there. And with that, for the consent agenda, are we ready for that?
Let me check my team. Wendy and Commission Grace on the licensure.
Yes, sir.
They're in there?
Everything's
Okay.
there. Yes, sir.
Yvette and Sarah on DPRC, they're all in there as well?
I just looked and I think all of the folders have
Okay.
everything.
Thank
in
you.
them.
Thank you, Wendy.
Yes.
Yes, we're ready to proceed,
Yes,
Dr.
sorry,
Zafran.
I couldn't unmute, but yes, we are good for DPRC.
Okay, very good.
All right, great. Thank you. All right, so with consent agenda, is there a motion on items 1 and, well, let's do item 1 first. Is there a
Quinones?
motion on item number 1?
Quinones, motion to accept consent agenda item number 1, consideration approval of June 13th medical board meetings minutes and action items.
Second,
Dr.
Jones.
Farmer.
Okay, it's been seconded. Is there any further discussion? All those in favor, please say aye.
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 All those opposed? Item passes. Is there a motion on consent agenda item number 2?
Quinones, motion to accept consent agenda item number 2, committee reports and consideration, approval of minutes and action items of committees meetings during the board meeting.
All right, a
Second,
motion is made.
Martinez.
Is there a second? Seconded by Dr. Martinez. Is there any further discussion? All those in favor, please say aye.
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 All those opposed? Agenda item number, consent item, agenda item number 2 passes. It's 8:58. It's not 9 a.m. yet, but I will go ahead and ask if there is a motion to adjourn.
Poconos, I'll make a motion to adjourn.
And I'll
Item number
second it.
32.
Oh, everybody was awake on that one.
Oh, yeah.
Is there any further discussion? All those in favor, please say aye.
Yeah.
All those opposed? All right. I don't know if this is a record or not, but it's not even 9 o'clock yet. Well, I look forward to seeing all of you in October. I know that there will be some information for all of you as to accommodations and everything. I believe it's going to be I know that it's going to be at the AT&T Conference Center. So be prepared to get that information, and look forward to seeing everybody in person. Good luck and thank you.
Have a great weekend, everyone.
Thank you.
Bye, everybody.